As Israel slowly becomes accustomed to its new normal, in India, scenes are quite different. The country is in a dire state as its health authorities battle the most difficult wave yet of the COVID-19 pandemic. Israel began sending emergency medical aid, including badly needed oxygen equipment, to India on Tuesday to help fight the surge. The ministry said a series of flights throughout the week would carry and deliver the much-needed equipment.
During the first days of the pandemic in Israel early last year, India has sent us much-needed medical equipment, including gloves, masks, and materials for medicines. This is now a small token of friendship and reciprocity from Israel to India. Well, today we are witnessing the first medical assistance that Israel sends to India. You are witnessing now yet another milestone of the bond, the unbreakable bond between Israel and India. Israel is standing now by India and sending medical equipment, oxygen generators, and oxygen respirators.
International aid has poured into India in response to the crisis as the country's health system struggles to cope under the weight of the new COVID-19 cases, with hospitals running out of beds and oxygen machines. Now let's speak to Rony Yedidia Clein, Israel's Deputy Ambassador to India. Thank you so much for joining me.
Thank you for having me.
So first of all, what exactly is Israel sending to India, and why is it so important at a time like this?
So it's sending a host of equipment. We've been able to put together an aid package of about 10 million shekels, which consists of oxygen generators, oxygen concentrators, which are the little individual machines in order to help people make oxygen, ventilators, a number of medicines, a wide variety of other medical equipment. It's all been brought together by the Ministry of Foreign Affairs, headed by Foreign Minister Gabi Ashkenazi, together with other government offices and Israeli economic bodies, such as the Indian-Israel Chamber of Commerce and other bodies alongside them. And it's so important because it's actually saving lives. I mean, every single ventilator and every single oxygen concentrator that we can bring saves another Indian life here, because they are running out of oxygen. The hospitals are really overwhelmed by the number of patients that are trying to come in. And as I said, every single little bit helps here in order to save a life.
So you've mentioned some of the organizations, but what exactly is involved in planning this whole event logistically? How many people are involved? How long does it take to organize something like this?
Oh, well, it's really been quite a feat of planning by my colleagues at the Ministry of Foreign Affairs, whether we're talking about the Economic Affairs Division headed by Yael Ravia Tzadok and Ilan Flus, Ilan is really quite on the whole matter, or the Asian division, which is sort of putting together the whole package. We and they are working together with the Mishlat, which is the body in Israel which was coordinating all of the care for Israelis during the corona crisis in Israel. And now, as one of my colleagues there was saying, we're used to receiving things and getting all the ventilators and all the oxygen machines here to help Israelis. And we're so happy that we're able to send it out now and help the world and help India specifically. There's a lot of moving pieces here and a lot of pieces of the puzzle that have to come together. We coordinate through the Indian Embassy in Tel Aviv. And as I said, the Ministry of Foreign Affairs, the Ministry of Health, there are some economic bodies which are putting together donations from various Israeli businesses and private people. Amdocs is sending about 150 ventilators, and other companies are also contributing their bit. And it's just so many moving pieces which are coming together into one beautiful picture puzzle that is coming here to help the Indians.
That's really wonderful. And of course, You know, in Israel, we are in quite a different situation now in terms of COVID-19. Can you give us an idea of what the situation is there on the ground, what it feels like in India right now with the pandemic, and what kind of practical level do you think that the equipment that Israel is sending will really help the situation over there?
Well, the situation on the ground is really quite scary, I have to say. You know, we diplomats, we're living here amongst the Indians. We don't live in a separate compound like some of the embassies do. We live in Indian neighborhoods, and we have Indians as our neighbors and friends and colleagues. And we see people and hear about people all the time who are getting sick, much more so than we had earlier in the year. Earlier in the year, and also in Israel, you know, you'd hear about someone here, someone there, but it wasn't quite as massive as it is now. Here, every day, someone that I reach out to in order to talk to them or in order to try to work with them, it turns out that they're sick. We have people calling us and asking for help in getting oxygen machines like we're bringing in today. There are WhatsApp groups in our neighborhoods of people looking for oxygen, looking for a bed in an ICU unit. These are things that hadn't happened during this whole year of the pandemic. And now they're all coming sort of to a fore and really becoming very, very frightening for people living here. Remember, we're here with small children, some of us. Our families are here with us, and we are very, very worried about what could happen to them. Most of the adult diplomats are vaccinated. Our children, however, those under the ages of 16 are not vaccinated. And so there is quite a bit of worry about them. And there's actually worry about what happens if one of us needs medical care, not just concerning COVID. You know, if someone falls and breaks his leg, what are we going to do with them? So this whole situation is quite frightening for a lot of people around here. And we're really hoping that the aid that we're bringing them will help them to overcome the crisis in the hospitals here, to make more beds available, to make more oxygen available, and perhaps to free up some of the medical staff in order to have them be able to take care of other regular medical emergencies.
All right, still, of course, a lot of questions in the air. Ms. Deputy Ambassador, thank you very much for joining me today.
You're welcome. Thank you for having me.